Howdy, folks. Eshan Lacoste here. Um, All Wise Transformation, where we talk about mental health, spiritual practice, and self-care. And today I'm sort of doing adulting stuff. It's a beautiful Saturday morning. It's about 9 right now. Got my coffee. Um, Currently doing laundry. Um, then I'm gonna go food shopping. Um, and then go for a hike, probably for a very long hike. Um, Trying to be outside as much as possible. It's fall, um, early October, and I wanted to talk about the various aspects of therapy, self-help, um, treatment, mostly like therapy. Um, for most of you who don't know, I'm a therapist, and I work with individuals who have substance abuse issues and individuals who have mental health issues from depression, anxiety, schizophrenia, borderlines. And I've been in the field now for close to 15, 17 years, give or take. And I've had clients who've died on me. I've had clients fire me. I've had clients who've left and then come back. Um, Not to say that my experience within the profession mirrors any other wellness facilitator, life coach, or therapist, or licensed therapist, or clinician, or licensed social worker. Um, but it is interesting to be in a country where you have the luxury, and to a certain degree, if you're financially able, the privilege to engage in talk therapy. Um, Now, talk therapy is anything that you're doing with another individual where you're verbally exchanging ideas, insights, feelings, coping mechanisms, trauma, transference, countertransference, um, with the hopes of the talk will give the person some insight into changing their behavior. Um, Talk therapy is a very Western thing. Um, I think in parts of the other world, in parts of the other worlds or other cultures, um, because there's only one world and we're living in it. There are other worlds as far as planets, but as far as we know, as far as I know, you know, this is the only one that has people living on it or sentient creatures living on it. I'm getting off topic. So Western society is a very interesting thing where we've capitalized on the ability to facilitate the healing of somebody on a mental and emotional level. Not saying that that's the intention of how all of this sort of started of talk therapy, psychotherapy, cognitive behavioral therapy, DBT, solution focus. They all have roots in philosophy. Um, and the idea of thinking for the sake of thinking, which I find to be very funny. Again, which seems to be a very sort of Western way of approaching things. Um, and so I really want to talk about like this idea that to a certain degree, individuals who are mandated either because they've gotten a DUI and they need to get their license back, and so they need to go to therapy to get the recommended treatment hours, or an individual who's going through a mental breakdown, and or an individual who is in the depths of their addiction and their life is falling apart. And then to go somewhere to talk to somebody, to share your trauma, to share your life experience, and to a certain degree, tell your version of the story. um, Not to diminish individuals who have gone through significant trauma. That's real. But there is a portion of people who, when you're sharing your story, you're only sharing your perspective, and there's a truth to that. And sometimes our memories can be a little skewed in the way that we remember things, and science is, showing that we shouldn't really rely on our memories too much. Our memories um, degrades over the years. Um, we may not think so, but what you remember, I remember a huge house. I remember as a young child living in a really really huge house. Um, Only to discover that it was a really small house, possibly one bedroom, and the only difference was my size, right? And so, as a small child, when you look at the world, it's going to look huge, and so that's perspective. And so, there's a portion of therapy that is about perspective, which is interesting because I had a conversation with my brother who doesn't believe in therapy. He doesn't. He he understands the value of therapy, but he doesn't necessarily believe that going to therapy that you will that going to therapy that the person that you're talking to will help you, right? Because it's that person's perspective. And my argument was that therapy, a good therapist, a good social worker, a good wellness facilitator, a good life coach, um, to a lesser degree, are not really supposed to be giving you opinions. Let me recategorize that. So, trained licensed therapists, trained licensed social workers, um, are trained not to give advice. I'm not a trained life coach or life facilitator, even though in my private practice I do go by the title as wellness facilitator, because I think I help people facilitate their wellness. At least that's how I perceive it, or that's how I think about it. And so when you go somewhere to talk to somebody about your problems, my brother feels like it's a waste of time, right? Like more so for him specifically. He doesn't see the value for him specifically, um, therapy, but he does see that it has values for other people, and it does, because therapy provides you time to be able to, if the person that you're seeing is trained and they're decent enough and good enough, they will help you have insight into your own thinking and behavior. If they're good. If they're not so good, then that probably is a longer process. And hopefully that you're savvy enough to be able to do research on your own. Because having one specific place where you're only getting information from, um, is very limiting. And you should be gathering information from all places, from your social media to books to YouTube to whatever. So like we live in an age where information is abundant. The issue with that is that sometimes some of that information could be saturated with misinformation or outdated information. And so that's why sometimes you need a professional or profession um, to help you sift through all of that. But the more I do this work, and the more that I feel like I get to a stage in my skills, it really becomes, to a lesser degree, about holding space. And for the longest time, I thought that I needed to have the answers to my clients or to my participants' questions. I thought that I needed to help them solve their problems. And in a way, I am, but they're the ones that have to do the heavy lifting. Um, I just offer a mirror for them to be able to see their own strengths and to see their own shortcomings where they need to sort of make a tweak. The changing process is difficult, and to go to talk therapy and to believe that in 10 sessions, in 20 sessions, or even if you've been going to therapy for a year, that change will happen overnight. Change is a very slow process, and sometimes very painful, because it requires, if you're consistent with it, and sometimes you may take a break, and sometimes you may go back, but if you're consistent on some level with the practice of healing, wherever that is, or the practice of finding equilibrium, wherever that falls for you, that sort of pushes you further to your own strength. So it's sort of like a weird mm, feedback loop, I guess. That's that's the description I want to use, which I don't think that's the description I want to use. However, talk therapy is a very weird profession. Um, it's a field where the value is minimized, but a lot of people go. It's a field where a lot of people want to be part of, but they're not necessarily trained. It's a field that is um, lucrative, but you have to hustle. And so I find myself to be in awe in what I do, because sometimes I sit with people when they share their most intimate memories to their most traumatic moments in their life, to individuals acknowledging that they are emotionally stuck or emotionally in limbo, and how frustrating and irritating that is. And so it's a profession that I don't really engage but accept holding space. And to think that there is a field where energetically you're providing healing, you're providing solitude. I don't know if that's the word I'm looking for. You're providing a quiet space, even the quiet space you're talking in the quiet space. It's a very weird profession, but I have to say that I've known that I wanted to be a therapist since I don't know how old. I know very young. Um, my memory is very spotty, so I don't remember much of my childhood. But I do know for as long as I could remember, um, maybe early teens, somewhere in my, 10 years old, 8 years old, somewhere around there, I knew that I wanted to be a therapist. I knew that I wanted to help people, but I didn't exactly know what that meant to help people. Um, Come to find out that there were all kinds of therapy, which when I thought of therapists, the only role models that I had, and it wasn't until years later that I realized there are other um, people of color who are therapists. But for the longest time, I always thought therapy was by a white German, bearded glasses, uh, cis man who has a patient in front of them on a couch. And then come to find out there agricultural therapy, there's yoga therapy, there's movement therapy, there's writing therapy, there's athletic therapy, there's so many kinds of therapists out there. And that was overwhelming to think about that. Um I did get into the field, I guess through the back door because I started doing therapy with individuals and substances. So I have my drug and alcohol license. So I'm a LADC therapist in the state of Vermont. um, but it's a very interesting profession where somebody comes to you and they give you a glimpse of their life, the good, the bad, the ugly, the numb, the destructive, um, the regrets. I just sit there and I listen. I try to provide Socratic questioning because it's only through curiosity that one can go a little deeper. It's through validation that one can sit a little longer in their emotional distress. It's a very weird profession. And I'm lucky. And then there are times when it's so overwhelming that you really truly want to save the people that you work with because you not only see the hurt and the pain, but sometimes you see the potential that's being wasted. And that is the work for a therapist. If you want to be a good therapist, you have to be very mindful of the countertransference and transference that happens. The moment I start believing that I know better, the moment that I start assuming that I know what's right, that's a very, very slippery road. Don't get me wrong, there are some very intelligent therapists, and there are very not so. And I'm always in constant struggle to be present and to be mindful of not making the session about me. And I think sometimes some therapists do make it about them, because to a certain degree, it's an ego boost. to have a status in society that says my job and my profession is to provide clinical support that's based on years of research, specifically like DBT, EMDR, uh, cognitive behavioral therapy, CBT, right? Like, those modalities have years of research behind them. Um, psychotherapy, not so much. But I think regardless of whatever modality that you use, I think the one thing that has been proven to be the cornerstone or the key aspect of a good therapist is an alliance, is a therapeutic relationship. If there isn't a therapeutic relationship, then I cannot hold space. I cannot be present. Or if you do not feel safe or do not feel completely aligned with me, um, then the insight is not going to happen because it's through the Socratic questioning that insight happens. Hmm. More so talk therapy. EMDR, there is no questioning. There are questions, but the questions are scripted. Um, and for the most part, you're sort of asking the same question in various ways at times. And so um, you have the client just really share what's coming up for them. Anyway, EMDR, fascinating. Never thought I would have been trained. Um, very fascinating. So I'm blessed, and I think in any other particular culture, um, my job would have been either a religious figure, sort of as a shaman, or a local healer. Um, And so there have been versions of my role that have existed throughout history, from the priests in a temple to the shaman in the village to the local healer. And so my role has had different names and different avenues, but it's still the same thing, helping individuals heal through mental or emotional shifts. If that is the placebo effect, or if that is the internal work that needs to happen. It's a very interesting profession. A profession that has a book maybe about this thick, maybe a little thicker, that has diagnosis of mental disorders that are coded for insurance purposes. So I get paid if I see somebody. And in order for me to see somebody, I have to diagnose them with a disorder, depression, anxiety, substance abuse. They need to get coded. So that sort of monetizes my profession, which is fine because even the shamans, witch doctors, healers, they got paid for their services. They either got like three chickens and some milk or some cheese or some bread or wheat or flour or something, but they got compensated. They got paid for their services. And I find that funny because as I'm shifting or making the attempt to go into private practice, um, I'm realizing I'm gonna have to sort of take on the administrative aspect of therapy, which I am not looking forward to it. But for now, I'm sort of in a place where I work for an agency, and so I have sort of the security of working for an agency. But I love my job. Sometimes my job is overwhelming. Sometimes I know my job, if I'm not careful, will burn me out. And lately, I have been struggling with creating time to heal myself. So talk therapy. It's a very interesting thing. Um, but it's a thing, and I enjoy it. I find I find it to be the most uniquest profession out there, you know. Hmm. Well, those are my thoughts. I gotta go do go finish my laundry and probably go food shopping. And then I'm gonna go on a pretty long hike. Anyway, happy fall and be kind to yourself.